Hi, my name is Hyunjung Kim, and I'm a professor in the Department of Management, California State University, Chico. I'd like to talk about the teaching materials we have been developing in relation to the diaries during lockdown project. It is still in progress, but we have enough materials on our website for you to check out and use them if you find them to be useful. So in this presentation, I'd like to share a little bit about why we created the teaching materials, what it looks like, and where we want to go from here. As you heard in David's presentation, we want to help general public better understand the pandemic dynamics. However, to fully grasp the implication of David's story and Ali's COVID-19 model, it would be helpful for our audience to understand some SD concepts. And we also thought this might be a good opportunity to disseminate SD so that people can start applying it in other areas. We also thought that this would be a good materials to share with the SD community in order for us to teach system dynamics to different audiences. So here are our target audiences. We are thinking about general public who visits our blog, and then students and instructors of an introductory SD course, and then maybe public health students or experts interested in exploring COVID-19 using the SD approach. As you can imagine, we are assuming our audiences to have very basic math skills and they are new to system dynamics. So here are some key features and strategies that I used in creating the teaching materials. First of all, it is different from a typical system dynamics introduction course because we're not really teaching SD concepts and using cases to apply those concepts. It's actually flipped around, and we start with a compelling case, which is COVID-19. And as we are replicating Ali's model step by step to represent this case, we will introduce some of the SD key concepts as we go along. Okay, and also I'm gonna try to tie each learning segment with David's story to highlight the real world implications. I have been teaching system dynamics online for the last year due to pandemic, and I learned a lot, and I really want to leverage on some of the things that I did in my class that turned out to be very successful. So in creating the learning materials, I was very mindful of the items listed here. So for example, in terms of contents, I try to minimize the reading required for my students, and I try to present things in a very brief, straightforward way with a lot of visuals. And in terms of organization, everything has to be easy to navigate, really well organized, so that student can study the materials in a self-guided manner. Also, student must be able to see their progress and achievement for each module of the whole curriculum. It is important for students to be engaged even though it's online. So it has to be fun, and there has to be a lot of hands-on activities. And it is important to have instructor presence even though it's online. Okay? And I try to use simple, non-technical language so that I don't lose my students. Okay? So the main tools or the platform that I used was Google Slides, and I refer to these slides as my virtual classroom. So all my instructions, all the learning materials, all the resources will be incorporated into these Google Slides, including my YouTube videos. Okay, and you will also see my avatar appearing here and there in the virtual classroom. It looks like this. Okay, and it just gives the sense that I'm there. I am guiding my students as they're learning the materials. They are not alone. So when you go to the project's website, here is where you can find the learning materials. It's right here. And as you can see, so the first two sessions introduce the basic SD concepts and why we use a simulation model. It kind of sets up the background for the rest of the learning materials. And things are organized in modules. And in each module, we will replicate a small segment of Ali's COVID-19 model. Module 1, we start from scratch and we'll create a basic pipeline of susceptible population and infected population. Okay, and in module 2, we're going to be adding what happens to the infected population when they start showing symptoms of the disease. In module 3, we're going to be adding the stock of recovered population as well as the cumulative death. So we are basically talking about outcomes of an infection. Okay, and in module 4, some of those people who have recovered, they lose the immunity, go back to the susceptible population. And in module 5, we create a feedback loop where the death rate will start affecting people's behavior by adjusting their number of contacts. So that's where we actually adopt information delay and table functions and things like that. Okay, so right now we have 5 modules, but we plan to go to up to like 13 modules. That's what we are planning right now. However, Ali's model is keep evolving with what's going on in the current situation with COVID-19. So it could be more than 13 modules. We don't really know. However, we want to make sure this is wrapped up by sometime this fall. Okay, so I'm going to show you an example. If we go to the module 2, and it is related to the David story about Uncle Ted. Uncle Ted has his own company, and it was really early on when we were experiencing emergence of COVID-19 cases in US, and Uncle Ted is considering whether he should have in-house testing for his employees. I usually discuss what the learning goals of this module is. So in this module, we are making a new assumption where when people show symptom, okay, they're going to quarantine themselves and they're not going to spread virus anymore. Okay, so this is the stock and flow diagram of showing our new modification. Okay, so we have susceptible population. Now the infected population, we are redefining it as infected asymptomatic population. And now we are creating an outflow here, which will be the symptom appearance rate. Okay, and this is the feedback loop of the new model that we're going to be building. So in module 1, we built this part. And in module 2, we are adding this outflow. So as soon as a symptom is appearing, they go out of the system, and now they are not really making contact with the susceptible population. And here I'm explaining the equation, the logic behind the equation. Okay, and I'm also trying to highlight the balancing loop that we just saw in the previous slide. And this is my YouTube video, which helps people to build this model. Okay, so I am walking them through, and we are also simulating the model, and we generate a lot of different graphs. We talk about some of the dynamics that we observe, okay, and we continue to do that. And I'm asking the questions like, what are the assumptions are we making? We go back to the Uncle Ted's story, and we talk about how the in-house testing may not necessarily solve the problem because Uncle Ted's employees, they are still making contact with other people outside the company who might have COVID but not showing symptom. So here we are talking about some of the modification that's going to be made in module 3. What's next? We would like everyone to check out the learning materials and let us know if you have any feedback. And also feel free to use it, and let us know if you need any additional support to use these materials. Thank you.